Hello guys, welcome back to Clinically Clear. Today let's look at some indicators of mother and child health. This is a bit of a formula thing, just a few indicators, their formulas, their current values, how they are significant, and what are the causes for the increase in each of these values. And in every formula, one thing you need to remember is everything is in the same given year. Example, if I take maternal mortality ratio, here I've written number of maternal deaths divided by number of live births. So it is number of maternal deaths in a given year divided by number of live births in the same year. So this is how this applies to not almost, to each and every formula. So let's start with the first one, that is MMR. Now, whenever they say MMR, we immediately think of maternal mortality rate, but it is not maternal mortality rate. See, when do we say something as a rate? Rate is when the numerator is part of the denominator. So if the numerator is a part of the denominator, then it can be called as rate. Whereas if numerator is a separate entity and denominator is a separate entity, then it becomes ratio. Example, if I talk about maternal MMR, here you have number of maternal deaths. The number of maternal deaths is not a part of the number of live births in a given year. So this is a ratio. So MMR, maternal mortality ratio, is the number of maternal deaths divided by the number of live births in a given year into 1 lakh. Very, very important. This is the only formula where we consider lakh. Every other formula we take 1000. So here we consider per lakh of live births. So now let's come to the current value. It is about 97 in India. Now United Nations has given something known as SDG, Sustainable Development Goals. Basically, these are certain targets set by the UN for each and every member country to achieve by the year 2030. So according to this, the MMR should be about less than 70 by the year of 2030. Now, the most common cause of this maternal death is postpartum hemorrhage in our country. Postpartum hemorrhage is due to direct causes. That's why direct causes are always more common, like obstructed labor, like uterine rupture, like prolonged labor, etc. So these are all causes where which can lead to postpartum hemorrhage. So direct causes are more common. You also have indirect causes of maternal death like anemia, infections, etc., which are less common but still occur. Therefore, what is the significance of maternal mortality ratio? What does it indicate? It is an indicator. It is an indicator of quality of delivery service, quality of maternal health care in our country. Better the maternal health care is, better the lower is the MMR. Example, in US, the maternal mortality ratio is less than 12, whereas in India, it is 97. So that indicates that the quality of delivery service, the trained professionals who conduct delivery there, whereas in India you have these local dais and etc., who conduct in village women who conduct deliveries in their homes, which is very, very risky. So that is the reason. Then what is maternal mortality rate? Maternal mortality rate is number of maternal deaths divided by number of females in reproductive age group. The number of mothers who are dying, they are all a part of the females in the reproductive age group, right, in a given year. So therefore, this is maternal mortality rate. What is the reproductive age group? From 15 to 45 years. From 15 to 45 years is the reproductive age group, into 1 lakh again. What is lifetime maternal risk? Lifetime maternal risk is the risk of a woman in a reproductive age to die because of maternal risk. Basically, the risk of maternal death for a woman, if you want to assess in our country, it is 1 minus maternal mortality rate divided by 1 lakh, not MMR. Whenever they say MMR, they mean maternal mortality ratio. Here, maternal mortality rate divided by 1 lakh. So this is the first, this is everything regarding mother. Now let's come to stillbirth. Now what is a stillbirth? Stillbirth is when a fetus dies within the womb after 28 weeks. Basically, it is a late fetal death. So the dead fetus, if you weigh it, it has to be more than 1 kg, and the crown rump length has to be more than 35 centimeter. So these three you can use to define what is a stillbirth. So stillbirth rate, if you're taking, it is the number of stillbirths divided by number of total births into 1000. Why total births? See, it is a rate. So if I take number of stillbirths divided by number of live births only, then stillbirths are not a part of live births. And in rate, the numerator has to be a part of the denominator. So stillbirth, number of stillbirths divided by number of stillbirths plus live birth. That is the number of total births into 1000. What is the current stillbirth rate? It is about 5. The most common cause of stillbirths in our country is placental disorders like placenta previa and abruptio placenta, leading to antepartum hemorrhage. So this is regarding stillbirth rate. Next, coming to perinatal mortality rate. What is the perinatal period? From 28 weeks of gestation till 7 days after delivery. So it includes both the stillbirths, the number of stillbirths, as well as the number of early neonatal death. What is an early neonatal death? Within 7 days after birth. So perinatal period is stillbirths as well as early neonates. So stillbirth period, number of stillbirths as well as number of early neonatal deaths divided by, once again, number of total births, because stillbirth is a part of the numerator, right? Whenever stillbirths come, you have to take the number of total births into 1000. Perinatal mortality rate is an indicator of quality of overall healthcare service in our country, not just maternal healthcare. Why? Early neonatal deaths, how do you prevent? Through neonatal healthcare. How do you prevent stillbirths? Through maternal healthcare. So it has both maternal healthcare as well as neonatal healthcare. So overall healthcare services, you can get the quality through perinatal mortality rate. Next, coming to 3 more important indicators: neonatal mortality rate, infant mortality rate, and under 5 mortality rate. Now, one thing you need to know is, see, if a baby is born here, then for the first 28 days, neonate. For the first 1 year, infant. And then up to 5 years is under 5 years. So, what you should understand is, neonates are a part of infants. Neonatal period is a part of infant period. Infant period is a part of under 5 period. That is what you should understand. So, neonatal mortality rate is the number of neonatal deaths, that is within 28 days, divided by number of live births into 1000. The current neonatal mortality rate is about 20, and the UN has set a target of less than 12, the UN SDG target. Then coming to infant mortality rate. Infant mortality rate, number of infant deaths, that is death within 1 year, divided by number of live births into 1000. The current value is about 28. Under 5 mortality rate, also known as child mortality rate, the number of under 5 deaths divided by number of live births into 1000. Denominator into 1000, common everywhere. So under 5 deaths is from birth till 5 years of age. Okay. Now here the value is 32. So what can you see here? Neonatal mortality rate 20, infant mortality rate 28, under 5 mortality rate 32. So that means in infant mortality rate 28, 20 of them are dying at the neonatal period itself. So majority of infant deaths are nothing but neonatal deaths. Similarly, in under 5 mortality rate, 32 out of those, 28 are dying in the infant period itself. So under 5 mortality rate, most of them are infant deaths. So everywhere, the cause has to be the most common cause has to be the same for all three. I hope you guys understood why I am saying the most common cause in all three, that is under 5 mortality rate or child mortality rate, and neonatal mortality rate, and infant mortality rate, all three are the same, that is low birth weight and prematurity. That has the same cause for all three. But low birth weight and prematurity, it cannot, you won't write that in the death certificate, right? So in medical certificate cause of death, the most common is asphyxia and hypoxia. But this asphyxia, hypoxia, uh, uh, diarrhea, pneumonia, all that, you can predispose it to low birth weight and prematurity. If you look at the overall cause, if you look at what is the main reason why the neonates are dying, is because of this low birth weight and prematurity. And the infant mortality rate is the best indicator for the overall development of a nation. When do we say a nation is developed? When the nation is able to take care of even its most vulnerable population. Who is the most vulnerable in a country? The infants. They can't do anything of their own. So when the infant mortality rate is low, that means the infants are being well taken care of and the nation is said to be developed. But if you look at what the UN says, the United Nations, according to United Nations, the indicator for overall development of a nation is under 5 mortality rate or child mortality rate. This is because UN thinks in the opinion of peacekeeping. It always talks about wars, peacekeeping, etc. And in wars, who are the most affected? It is the children, right? The innocent children are affected. So that is why UN considers under 5 mortality rate or child mortality rate to be the indicator for overall development of a nation. Now, child death rate is not child mortality rate. I don't know why this is why it's given like this, but that is how community medicine is. But child death rate is not child mortality rate, and child death rate is number of deaths of children aged between 1 to 4 years old divided by not live births. You can't put live births because 1 to 4 years old does not include live births, right? And for rate, the numerator has to be a part of the denominator. So you will take mid-year population of 1 to 4 year old. So you will take mid-year population of 1 to 4 years old into 1000. So this is child death rate. Now here the most common cause is not low birth weight and prematurity. Why? Because 1 to 4 years old, meaning you automatically exclude out all the infants and neonates. So here the most common causes: pneumonia, you have diarrhea, you have malnutrition, you have sepsis, you have accidents, you have malaria, etc. Child survival rate or child survival index, this is another formula. This is given by 1000 minus under 5 mortality rate divided by 10. Basically, the chance of a child, the percentage of children who are surviving up to 5 years of age, that is child survival rate. That is it for just an overall introduction to indicators. Some important indicators I'll be covering in great detail in the upcoming videos. So thank you for watching.